This is a site unlike any in the country right now, what we're doing here in Denver. We had about 160 samples come through yesterday. There's probably 160 cars just in the line in front of me right now. And so, the first step is to make sure that we have a justification for testing. Everybody who's going to be tested needs effectively an order from a provider. And that's the first thing that we screen for when we get here. And then, we need to keep our staff safe. One of the beauties of doing this outside is that you minimize the need for those negative pressure rooms and the potential for exposing a lot of other healthcare workers. And so, our staff is working really hard, and they're in a lot of uncomfortable personal protective equipment and doing this for hours at a time. This is a challenging response, and we are doing everything we can to meet the need. So I think we need to strike our balance here, right? The more testing, the better. But we also need to do some targeted testing and really look at where we can do surveillance in communities where we haven't found it yet. Because the earlier we find evidence, the faster we can respond and hopefully keep it from spreading. We do continue to get support from the federal government. The testing kits that we get here at the State Public Health Lab are shipped to us through the CDC. So we are getting that support. That being said, the swabbing kits, the collection kits, and the reagents that are used, we have to procure those on the open market, and everything is starting to go on back order. We're still learning a lot about how this illness spreads, and so I don't have an answer for you on what the undetected amount in our population is. I think as we've seen in other states and in other countries, there is probably a larger amount of low-level illness caused by COVID-19 that we haven't been aware of because of the limited testing.